So, now, so the only thing that is permanent in life is change. Many ways it's a change for better. That I'm very sure is the thing that we're running through the people living in the sub-Saharan Africa as of today. Why? Because their health delivery system is in shambles and they need something better. It is on. My name is Ahmed M. Aderebi. I'm here to present a research work, a paper on evaluating the visibility and acceptability of mobile health informatics for ambulatory care in sub-Saharan Africa using Ibadan, Nigeria as a case study. And the research work is being supervised by Professor Neil Gordon in the University of Hull. Now, basically, as most we all know, mobile devices is the new world order now, and it has revolutionized many facets of human endeavors, which both in developed and developing economies of the world. Nigeria, being one of such countries in sub-Saharan Africa, with a population of about 245 million, is part of this usage revolution, with mobile devices being used across different countries for a wide range of applications. Um, we all know that there are so many benefits that are accrued with the usage of these devices. Some of them becomes more handy and relevant in contemporary developing economies of the world because of their lack of access to cutting-edge infrastructures, which which we feel could improve their healthcare delivery systems. The increasing trend in the usage of smart devices has propelled many technological innovations in forms of self-contained programs, application packages, and what have you, all being designed to handle different purposes. There are many countries in sub-Saharan Africa with many ICT innovations deployed to boost the delivery of medical services in their domains. However, one cannot overemphasize the role being played by mobile devices, especially when it comes to monitoring of disease monitoring, monitoring and surveillance, especially during the last pandemic, as going by the way it was being used by government to ease communications between people and government too. Aside all this novel development that has been associated with the usage of mobile systems, it has been observed that many of these things were done by different countries, most of them for developed economies. In very few or little were recorded as far as developing economies, such as one of which Nigerian is concerned. Now, what really comes to mind is what are the objectives of this study? This study identified key challenges inhibiting efficient medical services delivery in most of these developing countries. Also, aside that, it also evaluated the feasibility of mobile health informatics deployment for ambulatory care in Ibadan, using that as a case study. Once that one has been evaluated, we now want to see the acceptability of such systems in that same community. Now, what are the research methodology? The research examined a lot of problems that has to do with the clogs militating against medical service delivery in some of those countries, using Ibadan as a case study. Then a lot of literature reviews were, undertakings, and the program theories were, formed. Questionnaires were deployed as data collection instruments to elicit data from respondents. Two hospitals were chosen. Two categories of hospitals were chosen. One private, the other one public. The private one being Bambi hospitals, and the public one being Aligongo Maternity and Bambi, all located at Ibadan. Now, in all, 100 questionnaires were distributed. Each of them marked for 25 questionnaires, and eventually about 64 questionnaires were returned. And these are the outcome of the research carried out to test the acceptability and the feasibility of the design, the implementation of this app to enhance on, to carry out this, to boost the delivery of medical services in that domain. Then, if you look at it very well, the first question says, are there challenges inhibiting efficient medical services in the country? The response was enormous. 53 out of the required number said yes, and only 7 said no, 4 not known. Then it also tested to confirm whether mobile health informatics availability is in Nigerian hospitals. The answer was no, meaning that it was almost non-existing, except in few hospitals where we have them. And aside that, it also evaluated the feasibility of deploying mobile health informatics frameworks. And yes, the respondents, the many agree that it is very possible, and the reasons not far-fetched, going by the rate of telephony in the country. And again, when you look at the preference of implementation of that mobile health informatics, whether it will be on mobile apps or on web-based app, the sizable number of respondents agree that it should be mobile. Why? Because of the general Gen Z populations with their preferences for mobile apps and mobile phones, coupled with the rate at which people are using that systems in the country. Then it also went ahead to test whether mobile health informatics is helpful in the discharge of the services of medics. And a lot of medical professionals equally agree that it will help in the discharge of their work. And we also asked whether most of these respondents have access to smartphones or Android phones. And a lot of them agree that they will prefer because of their access to mobile phones and things like that. And when you look at it again, it was also agreed that these systems, if implemented, from the research, 82.2 respondents agree that some factors were there which affect the efficient medical delivery of medical services among Nigerian hospitals. Then, sizable number of respondents are unaware of the availability of mobile health informatics in any hospitals in Nigeria. And again, about 59% had preferences for implementation using mobile health informatics because of their access to mobile phones. Then, while 35.5% do not want the implementation of mobile health informatics in the country because of their technophobic nature. Of course, most of those people that were in that category, they were the elderly and the aged, and you know what it means. And especially those in the underserved communities, perhaps because of the problems they are going through. And again, 76.1% of the medical doctors agree that the implementation of mobile health informatics would be helpful in the discharge of their duties, and 71.6% of the medics agree that they have smart and Android phone, which is a precursor to the implementation of mobile health informatics system. All these things put together, one can conclude that the research is acceptable and it will help to solve a lot of problems militating against medical delivery in Nigeria. And again, the question that really comes to mind is why this? Why? Because today there is JAPA syndrome and it's a global phenomenon. JAPA, which is in global terms means skill migration program as a result of drainage. I mean, brain drain. People try to leave one place, especially in developing economics, to develop economy in search of greener pastures. This has put pressure on systems, and more felt is in the area of health. And these and other reasons are what prompted the United Nations to come up with their SDG program. This one being as captured under SDG Go 3, where Earth for All by the year 2030 is being preached. And of course, like I said in the beginning, if wishes were to be horses, beggars will have loved to have a ride. Many inhabitants of those living in sub-Saharan Africa will have loved to see those things come into reality. And apart from that, if it is eventually implemented, some features will relatively be a common thing there. One of them is an appointment scheduling system where you can sit within the comfort of your house and book an appointment with a medic. Referral systems where when you are being referred from one hospital A to one hospital B, you may not necessarily have to go with your file. And again, we have medication reminder where if eventually you are given attention at a medical facility and prescriptions are given to you, you just need a system that can automatically be reminding you. And above all, an health education system that works in a way like as if there's no doctor. So that especially those that are in the troubled communities of Nigeria. Recall, global attention is being focused towards Nigeria now and has been tagged as country of particular interest, particular concern, with special reference to United States of American President Donald Trump, based on the genocidal attacks going on in the country. All these things are issues which we feel, if the system can come on board, will resolve. Because let us imagine those living in those troubled areas, especially where they are being ravaged by the effect of banditry, genocide, and things like that. Once they have access to their system, to their phone, and with health education systems installed on them, they can equally treat some ailments without necessarily having to travel down to the metropolis where doctors can attend to them. So it is on this note that I want to rest my case. Thank you once again.
Thank you. Thank you very much, Remy. Let's wait on Neil. Has Neil something to add before I open the floor to questions? Neil, anything more to add before we open the session up to questions?
Yeah, so Remy's covered the main points, thank you. As it says, we're looking again at sort of concept for what we needed to give mobile health in areas where they're struggling because of capacity. Again, Remy explained to me some of the challenges they face. So things like the sort of brain drain problem for having resources, and also in troubled community, the lack of access for medics to actually get there because of sectarian violence and crisis. Sometimes medics can't go into areas, and health sources can be very limited and inadequate. So the idea was, can we use technology in a that ethical way to try and help address one of these global challenges? Thank you.
Thank you. Thank you very much, Neil. And thank you very much, Remy, for that wonderful presentation. I'll open the floor for questions. Yeah, Daniel.
Thank you very much. That was a great presentation, Mr. Remy. Very, very great one. I remember while I was still in Nigeria, one of the things we tried to solve. So I'm a product manager. I built a digital product, and my product was meant to manage medication for Nigerians. But I think it was still very novel at that point, and we discovered that it wasn't going to scale with the current medical ecosystem in Nigeria, and we had to drop the product. And we switched to matching doctors with patients, to reduce the waiting timeline at the hospitals, because most of our doctors were already leaving the country at that time. So I actually see this. I'm hoping this comes into full implementation, especially in the global south, because I feel if we have this there, it would reduce the emigration of medical practitioners because the pressure won't be so much on them because there is a system taking off the pressure off them. They would be able to work stress free, and knowing that they don't have to come to the hospital to attend hundreds of clients or patients when most of them could have an engagement virtually. So I'm hoping that it will not just be something theoretical that governments global south would implement to make life a better place. It was a great presentation. I actually enjoyed it. Thank you very much.
Thank
Uh,
you. Thank you, Daniel. Just from my side, what it was wonderful to listen to it, and looking at telemedicine, and also some of these things will work. But what do you think is the state of play of even the public attitude towards such initiative in the country?
well, basically, for now,
Because sorry, just one more second. You've mentioned Japa, and I live in Northern Ireland, here in the UK, and I see a lot of medical doctors here. I go to Scotland. My son took part in the Skiffy international thing, and there were a lot of Nigerian medical doctors there, and a lot of Nigerian medical experts, doing many things. And some of these people, even though they are doctors, they come here. Not all of them are employed in their relevant field. They end up being security staff in shops, or being attendants in Lidl shop, Tesco's, and all these things. And actually, two of them in Scotland I spoke to. And I said, you are a qualified medical doctor, and you are here. What is it you are looking for? But these people cannot be blamed if the right environment is not created for them, for them to thrive. Now, what are some of your contributions or some of your comments there?
basically, on the issue of telemedicine, basically, like I said, we weighed the options of mobile apps or web apps. We discovered that telemedicine is more of like web apps, but with telemedicine may not work because there are problems in most parts of the countries.
Yeah.
And for telemedicine to work, there has to be this room where the medics will be there and in consultation with somebody somewhere, which with this mobile framework, we don't need that.
Yeah.
And again, going by the issue of JAPA settings, today, as we all know, there are about 37 states in the country, out of which only 9 are safe and secure. Because of that, there is pressure on professionals. Professionals are pressured because of those problems to japa. Not even for greener pasture again, but for the safety of their lives and what have you. So, and that is the more reason why you see them in Scotland, in everywhere. Recall, I did my master's in Coventry back in 2013. Then the rate of japa was very low.
Low, yeah.
But this time around, coming back almost 10 years after for my PhD, I discovered that japa is on the high side.
Yeah.
I now asked what the problem is. We discovered that the sectarian crisis back home, the genocide back home, and other things pressure them to embark on japa system.
Yeah.
So we now see that, okay, fine. You don't have to, because, of course, if you japa for peace and security, fine. But aside that, there are other cofactors like having a safe and secure place to work. You recall we had this Boko Haram, where there are some part of the country that said Western education is haram. They don't want it. Yet, there are people there that need medical services. So this system would address those problems. You get it?
Yep.
Because not all of them are in support of that trash called Boko Haram, whatever, sectarian crisis. They are there, but for medical professionals to journey down to their path becomes difficult. So that is what prompted the design of this system. Now, fine, stay where you are. Since MTN, Airtel is available through satellite and Wi-Fi 6, and once you have access to your phone, we deploy, information across to you so that you know how to access whatever and treat yourself, at least to start with, instead of dying without having anything to do with your ailment. So these are what prompted these systems. Also considering the fact that mobile phone is the in thing now, everybody has it, even the illiterate ones. So and we feel with that system, especially the sectarian system and whatever that power system, like like the first caller said, that when he was in Nigeria, he observed few things. Today, average doctors in the country are more preoccupied with clinical works, attending to attending to outpatients just to fill forms, things like that. But with this, with the coming up of this system, you don't have to come to the university, to the hospitals to start filling few forms. These are possibilities online before you get to the hospitals. And which once you now get to the hospitals, it becomes what matters most is attention, and our service time becomes relatively reduced. And again, I said there are two categories of hospital: the primary, the secondary, and the tertiary. Average Nigerian prefer to go to secondary hospitals. But you discover that when you get to most of these hospitals, you are referred to maybe UCH, load, and things like that. You get there, your file system is never available. In the course of that, anything can happen. But with this system, there is this inbuilt fast that allows for, online referrals. Once you get there, your file goes with you in virtual form, and access is, medical attention is given to whoever is in need of it. Instead of having to say, what were you given the last hospital? This kind of thing. It reduces whatever. And we feel this system will address this, and so that a lot of life can be saved.
Thank you. Daniel.
Yes, it's not really a question. It's just about what the presenter had said considering the global south and the emerging developing nations. And I think another thing that can actually alleviate or remove this stress from most of the medical practitioner is education, in the sense that a citizen of a nation, like say, as a Nigerian, at a very tender age, I should be able to know how to practice things as simple as CPR, first aid, because at times some of the things that are being escalated, and weighing pressures are being given to our medical practitioners are things that, with the right knowledge from primary school or thereabouts, we can easily attend to them. For example, you have someone that is choking, and rather than try to help the person, the next thing is we are trying to rush them to the hospital, and maybe by the time you get to the medical doctor, the props the issue had escalated. But with the right knowledge and education, I feel some of this pressure would reduce, and then it would help telemedicine practices grow bigger, gain buttress roots in the system. Just an addition.
Yes, yes, yes. You are very, very correct. It was from that background that we also added health education systems into it. For those that didn't go to conventional schools where they will be taught. You get it? Hello, sir.
I
Yes,
understand you.
There's
thank
a
you.
feature on the framework that talks about health education systems, where all those simple treatment is taught. Like you said, someone is choking now. Simply put, how do you do that? If you go to good schools, fine, they should be taught. But where some, like how Nigeria runs, there are some schools in the whatever that do not even have anything. They don't even have teachers. Talk less of everything. But I feel okay, fine. If you lack this at the elemental stage, Now, on this system, there's a facility for that, which is the education system. And that we now enrich that since we have seen someone that is really, signposting that as one of the key features that the system should also have. We'll make it more enriching so that it encompasses all those first aid treatments that can help navigate through medical waters.
Thank you.